My son had a obviously accident, and he was there, and everything was okay with the discharge department, and really service was good as well and everything. I'm quite happy with what they obviously done.
Yeah, the aftercare wasn't so good with the doctors and with the hospital. Two people, my mum, she didn't know, she ran the doctors and they said everything was fine. It was only until she went into the hospital, they told her that she had two things wrong with a blood sample. And also my daughter's dad, he didn't know that there was problems until he went into the hospital. So there needs to be more communication, definitely a lot better communication when you're leaving the hospital.
And I got so upset and so distraught by the whole not sleeping for 48 hours at the hospital that I ended up just discharging myself, which meant that my scan that would have been, they couldn't even give me a timeline when it was going to be. They said it might be today, it might be tomorrow, it might be the next day. And I just couldn't handle it any longer being there in that situation, in that ward with those people, and not being told much information. So all I could do at that point was go home to my own risk. I had to sign a form just saying that I'd discharged myself, not knowing when I'd get a scan, not knowing if I had any problems.
It was a bit disjointed when I was discharged. I had to wait for blood test results before I knew if I could be discharged. And then my medication had to be ordered. And there was a problem because there was only one doctor on the ward and he was called away. And the nurses were working really hard to try and get him to sign off on the medication, on the prescription, so that I could go that day, because it was already quite late afternoon. And I think the pharmacy closes at 7 o'clock. But he came back onto the ward and signed all that off. And when the nurse went through my medication with me, she said, "Oh, has somebody told you? It's shown you how to give yourself an injection." And I didn't even know I'd have to have injections when I went home. So I then had to be shown how to give myself injections, because I'd have to do that for the next 5 days, and had to demonstrate I could do it. So that sort of took a bit longer. So by the time I got home, it was quite late, and it was a case of getting home and going straight to bed, really.
I had my operation, few complications after, but I was well looked after, and I was discharged a week later, and she just said that, yeah, you'll be discharged, and my husband came to pick me up, and she was brilliant, she was really good.
When I was discharged from the hysterectomy, I did feel as if there should have been a bit more follow-up, which there wasn't. It was just, that's it. And I said, well, have I got to come back and talk over? Because I'd got questions. Somebody asked me before I went in what questions I'd got, but your brain doesn't function like that. But when you're lying there, you think of all these questions. I wish I'd have said this. I wish I'd have asked that. But there was no follow-up to ask those questions that I was interested in.
Yes, yeah, I was discharged. I had to wait for Jane because she worked, so I had to wait for her to come back. But they changed my dressing, and I think I'd had a new stocking as well. Yeah, they were brilliant. It was very, very good.
It's okay. I had to wait about 3/4 of an hour, but that worked in with me really, because my son said he'd fetch me. And they said, "Oh, we've arranged an ambulance to take her home because she's not fully fit yet." He said, "But if you're not there when we get her home, we shall have to take her into care." Of course, he was there.
Maybe 90% of the people were very positive about their experience in the hospital, on the ward. A common comment would be how under pressure the nurses were. What a marvellous job they did under the circumstances. But coming back to my telephone calls, there were a fair proportion of people who believed they'd been discharged too early purely because of the need for beds for other patients. That might have manifested itself in the fact that somebody's care package would have ceased on going into hospital, and people were being sent home before the care package could be reinstated. Linking to the pressure on the beds and people having to go out, there were concerns raised 4 or 5 times at people being discharged late in the evening. A regular comment I heard a lot was about the discharge procedure itself, or the experience was the time waiting for medication or prescription to come out of pharmacy. Again, a regular comment was, my medication's changed, I don't know when I'm meant to be taking it, why I'm taking it, and I need to be seeing the GP to explain it to me, and I can't get an appointment at my GP.
From a GP's perspective, it's a pretty mixed view of the whole discharge process, and I'd say there's 3 areas of concern. The first would be the timeliness of the information that GPs receive, and this can vary from a couple of days to sometimes weeks afterwards. The second issue would be the actual quality of the content of the discharge summaries, and in specific around what diagnoses were made, any initiation or changes of medication, and any specific follow-up instructions or actions for the GP. The third big issue would be around what actual information is given to patients and their families and carers. Quite often we find that after leaving hospital or ending an episode of care, they're quite confused as to what actually went on, what they may have been diagnosed with, and why they're on certain medications and what follow-up they need. So understandably they come to see us, and we try to go through that information with them. But I think the whole process could be streamlined to improve that continuity of care.
My key role is to be main point of contact for patients and families, so that I can constantly update them with the process and progress of their discharge for the patient. So if they were waiting on anything, or they wanted to know when the package of care was to start, I can keep them informed. Each day we have a board round meeting where a consultant's present, reg, therapy, and obviously somebody from discharge team, and then we discuss every patient, and if I feel patient needs support and discharge, I will straight away get the local authority involved and get the ball rolling. If a patient's medically fit but doesn't have the confidence to go home because they still feel they need support, then we have intermediate care beds in care homes where a patient can get support and build up the confidence before they're ready to go home. And then for my role, I would liaise with patient, family, care homes, GP to ensure there is a safe discharge. Majority of our patients' discharges are done before 6. We do try and discharge patients before lunch, and the trust provides a sandwich and take-home packed lunch. But obviously, if patient's going to be discharged to intermediate care bed or even to care home, it does depend on the time that the bed there is available, and also on families. We do rely on families saying that they can't pick up the patient, or they're not going to be at the home until evening after work, and then we do discharge to suit the families. But our main thing is we don't discharge frail elderly patients after 8. We do discharge them earlier in the evening.
When the prescription comes to pharmacy, then we go through a number of steps to make sure that the patient has the correct medication. And although dispensing is in a timely fashion is a very important issue to us, safety is our number one priority. When the prescription comes to us, we make a note that we've received it, we enter it onto our tracker system, and then it goes to the pharmacist for a professional check. They are looking that it's safe to give certain medications together, that the doses are safe, and that the frequencies are correct for those medications. We also check for allergies, and we also check length of course, because we don't want patients having resistance to antibiotics. Once the drug's been, or the prescription's been professionally checked, then it goes on to a dispenser who'll produce labels to make sure it matches the prescription. These will be checked each individually so that they all tally together, and then after that the prescription will be dispensed and the items labelled. They are then left for a final safety check by one of our trained technicians who will check each item individually before bagging it and sending it to the ward for the nurse to give to the patient prior to discharge. To help patients who are on complex regimes, we put patient information leaflets into the bags of medication. This informs the patients of a number of things, which includes the purpose of their medicine, possible risks and side effects, how and when you should take your medicine, and what things to avoid when taking or using your medicine. It also informs them to contact the ward if they're not sure about how they should be taking their medicine. The other thing that we do provide to try and help patients when they're discharged, and particularly to help with carers or patients who have problems in taking their medication, is to provide the medication in a Medidose box. A Medidose is a pack where it actually has the tablets individually packed so that they can take them, or the patient knows what time of day to take the medication and which day to take the medication.